The story of John and Jack narrates a distressing account of an expatriated family's struggle, marked by severe isolation and mistreatment at the hands of their affluent, abusive father and the healthcare system in Cyprus. Despite achieving professional success, John and his family face total isolation from their extended family, only reuniting during holidays. The system's negligence led to John's severe health issues, including severe constipation, sexual dysfunction, and other life-endangering conditions due to medication side effects. Medical malpractice, denial of necessary care, and psychological abuse are among the accusations leveled against the healthcare professionals, highlighting the systemic failures that perpetuated John's suffering. The text details the myriad ways in which John's health deteriorated due to the medication prescribed by psychiatrists, leading to severe physical and psychological consequences. From severe constipation and sexual dysfunction to metabolic disorders and medical negligence, the account paints a harrowing picture of the healthcare system's failings. Additionally, it highlights the family's desperate appeals for help, which were largely ignored by governmental agencies, police, and the press, exacerbating their plight. The tragic fate of Jack, who ultimately took his own life after being denied access to necessary psychiatric care, further underscores the devastating impact of the systemic failures on the family. Furthermore, the narrative sheds light on the legal and ethical violations perpetrated by the healthcare professionals, including the refusal to discontinue harmful medication, misdiagnoses, and the denial of necessary medical assistance. The video also exposes the detrimental effects of prolonged medical mistreatment on John's physical and mental well-being, as well as the subsequent financial burden and emotional toll on the family. Overall, the story of John and Jack serves as a poignant indictment of the systemic inadequacies and ethical breaches within the healthcare and social support systems, underscoring the urgent need for accountability and reform to prevent similar tragedies from unfolding in the future. What medical malpractices and violations of human rights did John and his brother Jack experience while in the care of the system? John and his brother Jack experienced numerous instances of medical malpractice and violations of human rights while in the care of the system. These include accusations of medical malpractice, causing bodily harm, exposure to death, illegal treatment, overtreatment, refusal to stop medication, wrong diagnoses, mental anguish, bullying, violation of human rights, psychological abuse, breach of public duty, gang formation, refusal of medical treatment, intimidation, and terrorizing against John, his mother, and his brother Jack. The healthcare professionals were accused of denying pharmaceutical, nursing, and medical access to Jack, which ultimately led to his untimely death. Additionally, John faced severe constipation and sexual dysfunction due to medication side effects, and the healthcare professionals were accused of neglecting to inform him of these common side effects. The system also showed a lack of monitoring life-endangering conditions caused by medication side effects, such as the inability to defecate, and refused to provide necessary medical care. Furthermore, the family faced total isolation from their extended family and experienced extreme poverty, despite the father's affluent status. These instances highlight the systemic failures and ethical breaches within the healthcare and social support systems, underscoring the urgent need for accountability and reform. How did the side effects of the medications prescribed to John impact his physical health and well-being? The medications prescribed to John had severe and detrimental effects on his physical health and well-being. The side effects of the medication, including constipation and sexual dysfunction, had a catastrophic impact on John's life. He suffered from severe constipation, leading to life-threatening situations where he was unable to defecate for weeks at a time, resulting in frequent visits to the emergency room and hospitalization. Additionally, the medication caused sexual dysfunction, which persisted for many years, severely affecting John's quality of life. The medications also led to metabolic disorders, short-sightedness, astigmatism, and melasma, further deteriorating his physical health. Furthermore, the overprescription and high doses of medication led to additional health issues, such as lipids processing dysfunction and potential kidney degeneration. The medications also caused adverse reactions, including allergic reactions and physical injuries, such as a disabled right hand. Overall, the side effects of the prescribed medications had a profoundly negative impact on John's physical health, leading to severe and life-threatening conditions, as well as long-term health complications. What actions or inactions by the healthcare professionals contributed to John's suffering and potential long-term health issues? The healthcare professionals' actions and inactions significantly contributed to John's suffering and potential long-term health issues. They were accused of medical malpractice, including overtreatment, refusal to stop medication, and wrong diagnoses. Specifically, they prescribed John a combination of medications that led to severe constipation and sexual dysfunction, without informing him of these common side effects. The overprescription and high doses of medication led to additional health issues, such as metabolic disorders, short-sightedness, and astigmatism. Furthermore, the healthcare professionals neglected to monitor life-endangering conditions caused by medication side effects, such as the inability to defecate, and failed to provide necessary medical care. Their refusal to discontinue harmful medication and their lack of monitoring led to severe physical and psychological consequences for John, including constant pain, blood loss, and severe constipation, which required a constant supply of laxatives and enemas. Additionally, the healthcare professionals' failure to address John's severe vocal tics, misdiagnoses, and refusal to send him to a psychologist for a simple OCD problem further exacerbated his suffering. These actions and inactions by the healthcare professionals not only caused immediate harm but also posed a risk of potential long-term health issues for John. What were the systemic failures and shortcomings in the healthcare and legal systems that led to the tragic outcomes for John and Jack? The tragic outcomes for John and Jack were the result of systemic failures and shortcomings in both the healthcare and legal systems. The healthcare professionals were accused of medical malpractice, including overtreatment, refusal to stop medication, wrong diagnoses, and neglecting to inform John of the common side effects of the prescribed medications. This led to severe physical and psychological consequences for both John and Jack, including severe constipation, sexual dysfunction, metabolic disorders, and other life-endangering conditions. Additionally, the healthcare professionals failed to provide necessary medical care, monitor life-endangering conditions caused by medication side effects, and address John's severe health issues effectively. The legal system also failed to protect Jack, as he was denied access to necessary psychiatric care, ultimately leading to his untimely death. Furthermore, the family's desperate appeals for help were largely ignored by governmental agencies, police, and the press, exacerbating their plight. These systemic failures and shortcomings in both the healthcare and legal systems underscore the urgent need for accountability and reform to prevent similar tragedies from occurring in the future.